why do we do all this? A couple of numbers that you may or may not have heard about prostate cancer. So the whole reason that we do it is that prostate cancer is now New Zealand's most diagnosed cancer. I'm not kidding about that. There are skin cancers, but there are various different types of skin cancer. When you group them all together, okay, skin cancer is the most diagnosed type. But in terms of a single type of cancer, and certainly the biggest internal cancer that you can be diagnosed with, prostate cancer is the most diagnosed cancer in the country now. 1 in 8 men will develop it in their lifetime. That number is actually consistent globally. There's only one group that seems to be more at risk of prostate cancer, and that's Afro-Caribbean men. They have a much higher incidence of prostate cancer, and nobody really knows why. But other than that, generally speaking, 1 in 8 men will be diagnosed with prostate cancer in their lifetime. That translates into about 4,000 being diagnosed every year. Unfortunately, around 700 die. Now, how are those numbers going to change? There was a study that came out at the beginning of this year on cancer burden in New Zealand, and it said that between 2014 and 2018, about 20,000 men were diagnosed with prostate cancer. They estimate that between 2040 and 2044, 40,000 men will be diagnosed with prostate cancer. So we're expecting diagnoses of prostate cancer to double. One of the good things about prostate cancer is that if you are diagnosed early, curative treatment is possible. So the idea is, and this is, I've skipped ahead a point, but one of the, where it says that over 60% of survivors surveyed reported no symptoms when diagnosed. Prostate cancer starts growing without you even knowing it. It can be detected before it causes any symptoms. That's the point at which you want to know you have it, because that's the point at which the medical professionals and the healthcare professionals can apply treatments that can be curative. So a lot of our campaigning is about telling them to engage in the testing and screening that's required to detect prostate cancer early. One thing that's really, this statistic isn't actually on that slide, but which tends to make people sit up and listen, is that prostate cancer is now the second leading cause of cancer death in men in New Zealand, behind lung. What that means is that you'll hear a lot about bowel and colon cancer and colorectal cancer. Prostate cancer kills more men than colorectal or bowel cancer. That's not a record that we're proud of. It's something that's happened, but the numbers of prostate cancer deaths are going up. We have past bowel and bowel/colorectal cancer. So it's an issue. It's a huge issue. Your family history and genetics makes a big difference when it comes to prostate cancer. If your brother or your uncle or your father or your grandfather were diagnosed with prostate cancer, you are 2 to 3 times more likely to develop it yourself. So that is one thing that we do say. So there are a couple of messages in that. It's really important for men to talk to their sons and to their grandsons about their own medical history. That's a conversation that could save a life. If you are 2 to 3 times more likely, then you'll screen yourself more carefully and you'll detect it earlier and your outcomes will be better. So that's the general environment in which we exist. Prostate Cancer Foundation history, we were founded around 25 years ago. We're an incorporated society with a membership structure. So we have members all around the country. That's different to participants. So just because you participate in CrossFit doesn't automatically mean you're a member. Becoming a member means actually applying to be a member and becoming a member, and that makes you part of the governance of the organisation. It means that you get a vote at the AGM. We're a registered charity. We operate 2 brands, the Prostate Cancer Foundation in New Zealand and Testicular Cancer New Zealand. So as far as the public is concerned, those are 2 different kinds of organisation. Testicular cancer is another discussion, but generally testicular cancer, while prostate cancer is the most commonly diagnosed cancer in men, full stop, testicular cancer is the most commonly diagnosed cancer in young men age between 15 and 40. So we do a lot of 45. So we do a lot of work in that area, and we do it through a vehicle that we call Testicular Cancer NZ. we have our national office where we're talking to you from now in Albany. As I said, we have around 10 staff divided into four departments: finance and admin, support and education, communication and fundraising. We have at least 100 volunteers that get involved with us every year in some capacity or another. Our mission and vision is to significantly reduce and ultimately end suffering from prostate and testicular cancer, which is fairly self-evident, fairly self-explanatory. We do this by providing support, going out and conducting education. We conduct advocacy, and we also fund research. Those are our four areas in which we operate to try and make a difference around prostate and testicular cancer. The support services, we were just talking about those before, so just a little bit more on those. Raymond was talking about the information service. It's a nurse-led information service. You can access it anywhere within the country from an 0800 number, or you can email it, or you can also access it through the website online. And that's where you can ask any kinds of questions that you want to ask about prostate cancer and get information back. We do not provide medical advice through that line, but we do provide information about the disease. We have around 45 in-person support groups. Those are groups that organise meetings every month or every other month, and people come along with it. Sorry, those are just a couple of the groups that we operate in. We have one in North Shore, we have one in Orewa, we have another one in Bosnia, which would be of interest to you in Howick. Of course, a number of the Howick attendees at the Howick Prospect Group will be going to the Botany Support Group as well. We have Prospect as we have a program that we do. We provide via email, where we provide information and advice on exercise, on nutrition, on stress reduction and relaxation, and also we provide high quality information about prostate cancer. We call that Prostate Cancer Patient Empowerment Program. So you don't have to turn up, you just have to sign up, and we send you an email every day for 6 months on all of these issues. So that's another remote service. That's an example of a remote service. So we have no in-person contact with these people, with the men that engage with that program. So that's an email program that we run. We provide peer support. Quite often, someone will ring us on the information service 0800 number, or email us and say, "Listen, all I want to do is talk to another guy who's going through the same, or who has made the decision that I'm thinking about making," is usually the thing. So someone will be considered. One of the treatment options for prostate cancer is what's called a robotic prostatectomy, where it's a surgical procedure where they take out the prostate. A gentleman, or even a gentleman's partner or spouse, will ring up and say, "Listen, I just want to talk to someone who's gone through that procedure." We'll act as matchmaker and hook those people up with each other so that they can talk to each other and share their experience. Rainbow Blue, the experience of the LGBTQIA plus community who go through prostate cancer is different. The way that the health system deals with them is different. They don't get really the kind of support or the kind of tailored responses that they need. So we have a program which is really a peer support program called Rainbow Blue, where we connect members of the LGBTQIA plus community with people from that community who have been through prostate cancer themselves. We have an online support forum which you sign up for through the website. Okay. We have a few hundred or so interactions with that every week. Have about 700 or 800 people signed up for that. That's, as you would expect, an online forum where you can go in, post a question, and the hive mind, which includes some health professionals, will give you the benefit of their experience and their knowledge with regard to the issue that you're asking about. We provide free counselling. It's a brief intervention service. Basically, we provide 4 sessions of free counselling with a registered counsellor to anyone affected by a prostate cancer diagnosis. So that can be someone who's been diagnosed themselves or a family member. And it's really come about as the need we identified of people going through prostate cancer who are experiencing emotional distress. The model is very similar to CrossFit in the sense that we partner with an organisation called Southern Cross Workplace Health. They manage the roster of counsellors and manage those counsellors. And we connect, and we are responsible for both funding and promoting that service to people in the prostate cancer community in terms of actually physically delivering the counselling. As you guys physically deliver the training, Southern Cross Workplace Health and their roster of counsellors deliver the counselling to the people that are affected by prostate cancer who need that particular service. We also provide welfare grants and what we call allied health grants. Welfare grants are where you need help with the basics. There are a number of self-employed people who become affected by prostate cancer who are unable to work, and they find themselves in quite a bind. To try and help out with that, we provide grants to them for the basics. So we're talking groceries, helping with public transport, that kind of thing. We also have another grant that we call the Allied Healthcare Grant, which is where we assist men to access physiotherapy, continence products that will help with sexual rehabilitation. So we provide grants in that area to help men and their families to get through the whole thing. Testicular cancer, pretty much the same. Just really briefly, we have a counselling service, we do the welfare grants, and we also have the information service that we promote to people under the Testicular Cancer NZ brand, and people affected by men and their families that are affected by testicular cancer make use of those services pretty much every day. Advocacy. What do we do at a national level? What are we trying to change in New Zealand to make things better? Three main things. Talked about screening. So basically, at the moment, whether you get your prostate cancer detected early depends on you having a relationship with a GP. It also depends on that GP offering you a screening test. We would like that to change. We would like there to be screening exactly as there is with breast cancer. Now, I don't know whether you're aware, but the Breast Cancer Aotearoa has been set up to run breast cancer screening. It contacts every woman who becomes at risk of breast cancer and offers them a free mammogram. We want the same thing to happen with prostate cancer. And to start that process off, we want the government to fund a 2-centre pilot into centralised population-based risk stratified prostate cancer screening. So that's one of our major advocacy asks to government at the moment. Got a bit more difficult over the weekend because we've done a lot of work with Shane Reti. Now we're going to have to do a lot more work with what's his name again? Simeon Brown. Simeon Brown's the new Minister of Health.
Yes.
So now we're going to start again on him and start banging on his door and saying, can we please have a prostate cancer screening pilot, sir? We want universal access in the public health system to bottom diagnosis. Now, some of you you'll have people in your classes that are going through this. The way it works is that a blood test is what you need to let us know that something's going on in your prostate. If the blood test indicates that something's going on in your prostate, the next step that you really should go to is to have an MRI scan of your prostate. The MRI scan will then tell us whether you need a biopsy, and it's a biopsy that definitively diagnoses prostate cancer. It's when they get the cells out of the body, have a look at under the microscope, say, yes, you have prostate cancer. So we are, unfortunately, most men going through the public system do not have access to MRI scans. We want that to change. That has to change. It's a really essential part of the diagnostic pathway. There are a lot of men in New Zealand that are going straight from the blood test to a biopsy. The biopsy is invasive, it's not very pleasant, and it carries risks. The MRI helps us hugely. It's been referred to as a game changer to make sure that only those men that need a biopsy get a biopsy. We really only want those men that need a biopsy to have one. And the last is medicines. You would have heard in the news about all the issues around Pharmac and the fact that New Zealand doesn't fund medicines properly. That's particularly the case with prostate cancer. And there will be men that are coming into your groups that are living with prostate cancer. They've had a diagnosis of prostate cancer, but they haven't been able to get rid of it completely. So what they're doing is undergoing what they call systemic treatment for prostate cancer, which is living with it, basically playing whack-a-mole with it, keeping the cancer under control so that you can live out a full and a full life. There aren't enough. There are lots of medicines that are available overseas that men in Australia get, that men in the UK get, that just aren't funded and available to men in New Zealand. So we're fighting very hard for Pharmac to fund more medicines to treat prostate cancer. Those are our three main advocacy asks that we're talking about with government. We do a lot of education and awareness. Prostate Cancer Awareness Month is September, you'll be aware of that. Testicular Cancer Awareness Month is actually in April. We go out to community hubs, workplaces, schools, we attend public awareness events and activities. We go to webinars and roadshows, we do patient information seminars. Some of you may have been aware of the Life After Treatment patient information roadshow that we did and the webinar that we're doing tomorrow on that. We also attend medical conferences and raise the issue of prostate cancer with health professionals who do sometimes need to be reminded that prostate cancer needs a bit of love and affection. Supporting Prostate Cancer Foundation New Zealand and Testicular Cancer New Zealand, we don't receive any government funding to do all this work, none at all. So all of this work that we do relies on organisations and companies and individuals and grant funders to make it all happen. As I said, Testicular Cancer Awareness Month is in April. We usually do some kind of fundraising activity to go along with that, to fund the welfare grants and the counselling service and everything else that we do for testicular cancer patients. CrossFit, the main thing that helps us keep CrossFit going is called Dry July. I'll speak a little bit more about that in the next slide. As I said, Prostate Cancer Awareness Month is September. As you'll see there in that little tile that's there, we run a campaign called Blue September, which is our fundraising campaign in September. We ask people to do a blue do to help them make through. That basically means that they can do a fundraising breakfast, they do a fundraising lunch, they can do a fundraising challenge event, they can even make a donation. All of those things happen in September as part of our Blue September campaign. And of course, that's the website address to access the fundraising campaign for Blue September. Dry July, really, really massively important to CrossFit. Dry July is run by an organisation called the Dry July New Zealand Trust. It's basically what you would call an abstinence challenge fundraising event. We're a beneficiary charity of it. There are only a few beneficiary charities. There's us, there's Pink and Steel, and there's another charity called Look Good, Feel Better, and we're all active in cancer. That's the big thing. So Dry July Trust exists to raise funds and grant funds to organisations that are working with cancer patients. We happen to be one of those charities. We put all of the funds that are raised through Dry July towards CrossFit. So the main supporters of CrossFit. The way it works is that individuals and teams get their families, friends and colleagues to sponsor them to go dry for the month. There are a couple of really quirky little things that you can do with Dry July. So for instance, if someone has a wedding to go to or has an anniversary in the middle of July, you can buy someone a golden ticket. So if one of your mates is doing Dry July, you can spend $15, or at least that's what it was last year, I think, and buy them a golden ticket so that they can go to their event, they can go to their anniversary and have a glass of champagne or two, which is kind of cool. So there are a few things with Dry July that they do which are kind of fun. But the idea, and as you said, one of the things that they suggest is someone donates the cost of their morning coffee. So you support someone by just giving them $5 or $6 in support of them going dry for July. The way it works is that a person, an individual, registers an individual, and this is really important to CrossFit. One person in the group, in the CrossFit group, will register as an individual. Having registered as an individual, they're then able to create a team. It's really important that you understand that. You cannot create a team without first registering to participate in Dry July as an individual. A few people, some of the trainers tried to go in and create a team for their group, and couldn't work out why they couldn't. And that was because the way that Dry July is set up is you actually have to register as an individual first. Once you are registered to take part in Dry July, then you can create a team around you. Then other people in the group can register as an individual, as individuals taking part in Dry July, and they can join that team. So that's the way it works. It's really important that we get as many of the groups throughout the country registering Dry July teams this year. It's the income that we received from Dry July last year was down. This was across the board with most fundraising activities and charities engaged in 2024. The economy hit. That meant that people were donating less. That means that the amount that we raised from Dry July was a lot less last year. And that is putting a squeeze. What we'd love to expand CrossFit to every part of the country. That's making it really difficult for us to do so. We don't have the money to be able to do that. So honestly, it's in CrossFit's interest that as many of the groups as possible register teams for Dry July. And of course, July will be here before we know. The website address for Dry July is dryjuly.org.nz. So that, okay, before we get into some of the specific issues for discussion for today, does anybody have, that's a quick run through.